A lot of it depends on where the patient is and what they feel is the best form of treatment for them, right? Some form of treatment is better than no treatment at all. So if I see a patient who is BMI in the 70s who tells me that the only thing they feel comfortable doing is taking an oral GLP-1, then that's what we're doing. Because some form of treatment and opening the door to that conversation and meeting that patient where they're at means that I have an engaged patient. It means that they know that I'm willing to work with them, right? In terms of how do we know what's the right therapy for them? Well, a lot of that depends on the response. Many patients may be apprehensive about doing something that's procedural because the idea of surgery carries with it a connotation of risk. And this is true in everything that I do in my life because I'm a surgeon. Everything that I do with it carries risk. But the reality of the matter is that driving your car also carries risk. And the risk of surgery in today's day and age, in the way we do it now, is very minimal. If you look at the data now, the risk of bariatric surgery, even our most complex surgeries, carries a level of risk that is very similar to that of having your gallbladder removed electively. It's actually, in some studies, safer than having things like having a knee replaced or having spine surgery. So the complexity of operations has allowed us to deliver really excellent obesity treatment, but the way that our technique has evolved in the last 20 years has allowed us to deliver very safe surgery. Now you ask, how do we make that decision? Who goes to surgery, who goes to obesity medication? If a patient is on obesity medication, I usually tell them, give yourself a window of time. You should be able to tell whether the medication is working for you if you have titrated to the maximum dose and you're on that dose for at least 3 to 6 months. And if you're not seeing a shift in your body weight that is at least 5% or more, and you're on the maximum dose of that medication, you may not be somebody who responds to that therapy. The other things that may push patients away from medication are side effects, right? They may be a lower BMI patient, but if they cannot tolerate the side effects of drug therapy, they might push them towards something that's more procedural.